Hi, I'm Dr. Ann Pendo, the Senior Medical Director in Experience of Caring at Intermountain Healthcare. And today I am excited to welcome Dr. Tamara Todd, who is an emergency medicine physician at Intermountain Healthcare, but also has several administrative roles, one of which is the co-director of the simulation lab for Utah Emergency Physicians, and then a medical director for care transformation and information services. So we are delighted that you're here today to talk a little bit about your leadership journey through our time of COVID.
Thanks for having me.
You're welcome.
It's really nice to talk.
Yeah, it's great to see you.
You too.
So let's start before COVID. Tell us a little bit about what your job was prior and then how it changed once we started really focusing on taking care of our patients who were at risk for COVID-19.
Well, so before COVID, #before, I was an emergency medicine physician. Of course, I still am. So practicing, seeing patients in the emergency department 10 to 15 times a month. And then as a ancillary part of my role for administration, I also worked in clinical informatics, serving as a medical director for our informatics division of Intermountain, trying to improve the EMR experience for all users and improve both the patient experience and patient outcomes by leveraging technical tools and our provider experience as well, to make them have more time by the patient bedside and less time with clicks.
Which is a really daunting task. And we're so appreciative that you were doing that. So when COVID started, or when you became aware that this was going to impact your day-to-day work, tell us a little bit about what happened and what did you do?
Well, I had a bit of an interesting transition back because I came off maternity leave on March 5th, and the time of COVID started to hit us more aggressively around March 10th to 12th. And so as I was jumping back into the fray, it became very obvious that we needed to manage our pandemic response and to keep our patients' care at the forefront and then keep our healthcare givers safe. And so a part of that was, how do we appropriately clinically manage these patients? How do we evaluate them from a community perspective? How do we evaluate them if they're trying to come into our emergency department and critically ill? And so I was given the role of technical lead for COVID testing for the system, regardless of location, whether it was an ambulatory setting or in an acute emergency setting or an inpatient setting, and all the different processes that flow through that moment of testing.
Wow, really broad.
Yes.
And really something that was desperately needed by people in many different locations. So what allowed you to step into this in a way that was all in?
Well, I had a lot of trust from my own leaders and my bosses, and a phenomenally engaged team that mirrored both the clinical needs and workflow with the technical needs to support them, and having frequent, very creative discussions on an hourly and daily basis to say, how could we stand this up? And when we were given the task of curbside testing, I think it was March 12th, we were told we need curbside testing set up and live in 4 days.
Wow.
And we went live with 10 sites in 4 days. And currently we have 27.
So what did you learn about yourself during that time?
I love solving problems. I love talking to people. I love delving into, what is your workflow? What does it mean when you take the test tube in your hand and you trying to figure out how you're going to put it into the lab, and what's your process of right hand to left hand, of click to label, and how that interacts with what an MA does when they are collecting the specimen, and how it interacts with what a provider does when they see the results. I love that. So it was a unique honor to be given that challenge, and something that I dove into very aggressively.
Yeah, I can tell. Just the smile on your face and the energy with which you're speaking tells me how much you love that. What kept you up at night?
The thought of my coworkers and friends and patients being taken care of without the critical information they needed. The thought that a patient could arrive and the team wouldn't know their COVID status and they wouldn't be able to care adequately for that patient or to protect themselves adequately, that kept me up a lot.
And what kept you going?
Honestly, the energy of the teams. I mean, the human spirit is amazing. People, even if it's a nurse on the front line or if it's a PhD programmer on the back end, people were pulling 100 hours a week to try to keep patients and caregivers safe. And they were all in. And it wasn't just one person or two people. It was the whole clinical and informatics team together rising to the occasion.
Wow. So what are you going to do differently going forward?
We have a little bit of breathing room now.
Mm-hmm.
And so strategizing for how things will look in the upcoming respiratory season is different than standing up a testing in 4 days. I have really enjoyed and learned not only the process of problem solving, but the process of delegating a problem.
So are there specific phrases or ways that you provide the environment that allows for that type of conversation?
Sure. It's interesting because all of our conversations are via video conferencing now, and so the techniques are slightly different than previous. But I'll present a problem, we have this problem A, and then ask open-ended questions. Let's throw out 3 ideas on how to address this issue. Let's be creative. And then I'll pause and let that silence build up a little bit until people are, 4 seconds, 5 seconds, 6 seconds. And then some ideas will start moving forward. If that doesn't get them, then sometimes go around the room and call out, hey, Sherry, what do you think? What can we do with this issue? And those moments of thinking and potential need to be respected. Otherwise, we're just filling a vacuum and we're not actually being creative.
Great. Those are really going to be useful. I'm going to keep track of those comments after we leave and use those in my meetings. So you were sharing with us how much time your team was spending at work. What are the things that you are doing to take care of yourself? You've got a small baby and you've got this large responsibility. What do you do to take care of yourself?
Well, I recently got a stationary bike trainer.
Very good.
So I'm doing meetings on the bike trainer, which feels silly, but actually has been really helpful the last week. I have managed to start carving out time after 6 p.m. to be with my family.
Nice.
Which I haven't had for the past few months. And I have a very engaged, wonderful husband who's been caring for the kid, honestly, a lot of the time.
Yeah, that's great.
Yeah.
That's good to hear. So what lessons have you learned as we wrap up our time together today?
I've been so impressed with the quantity of the human spirit and generosity. People want to help. When there's a crisis, people dive in. And I'm inspired by that with every team I engage with. I've learned I have to sleep, and so do my team members. And so one of my biggest goals besides protecting patients and the frontline caregivers is protecting my team too. So if we have a change that needs to go on, let's make sure they have Memorial Day weekend off. They've worked the last 3 months really, really hard.
I love that. I love that. It's so great to see you. Thanks so much for spending time together today.
Thank you. You too.
Yeah, it's good. And thanks everyone for joining today, our leadership during the time of COVID.